We continue to have elected officials during the pandemic who now have stepped down and are writing books and talking about how there's certain things that they should have done or that they knew that were not going to work during this pandemic. Jerome Adams was a Surgeon General from 2017 to 2022, and he has a new book coming out. In his tweet this week, in order to promote the book, he talks about how ventilation was the biggest missed opportunity during the pandemic. And I just have to tell you, this makes me so utterly irate. My blood was boiling when I read this tweet. Like, how dare you? How dare you say ventilation, which is literally in Pandemic Preparedness 101, right? Talking about how to dilute a virus or, get it out of circulation, the destruction technology. All of these things I learned very early on in 2020 as a nurse working for the Native Americans at Phoenix Indian Medical Center. When we started talking about masks, and I thought, why would we wear masks? We don't wear masks during flu season. How big is this coronavirus? And my research literally started there. What do masks filter? What do surgical masks filter? What do N95s filter? And I, through my research and in constant exploration of the truth, because I had the discernment immediately to know that something was up, I found two experts, Tammy Clark and Meghan Kelly. They were out there promoting on Facebook and traveling around the country, speaking and testifying at different places on the ineffectiveness and the harms that masks could cause. So we have this Surgeon General come out and in a tweet that I will share with you, and then we'll bring on the experts, Tammy Clark and Meghan, to share in their response to this and what they've endured with him. So he says, our largest missed pandemic opportunity is absolutely ventilation. It's disheartening to see how this crucial aspect has been overlooked throughout the pandemic. Overlooked. Wow. Ventilation is a solution that is both politically and medically non-controversial, requiring no significant effort on the part of individuals. And yet it has the potential to significantly lower harm, not just from COVID, but also from allergies, asthma, flu, and pollutants. It's puzzling to me why this administration and politicians haven't placed more emphasis on this simple yet effective measure. By improving ventilation systems in public spaces, schools, and workplaces, we could have mitigated the spread of the virus and saved countless lives. Moreover, the benefits of enhanced ventilation extend far beyond the current pandemic. By prioritizing this aspect, we could have created healthier environments for everyone, reducing the burden of respiratory illnesses and improving overall well-being. With that, ladies, please step in and introduce yourselves to the audience and let it rip.
Well, I'll go first. Ooh. So many of your followers know us. We're colleagues and friends. I'm Meghan Kelly. I'm a 21-year senior industrial hygienist and environmental specialist, but it's easier to say exposure scientist. So before I hand it to Tammy, I have to tell you, I was tagged on X or Twitter to this tweet. And to say I lost it would be putting it mildly. I had every emotion flow through me because everything that is said in that tweet is literally what Tammy and I do in our professions.
Yeah.
And we have been telling him this for the last 3.5 years while he was busy ignoring us, blocking us, censoring us, and pushing masks. So when Kristen says she lost her, you know what? It was like, we had no words for this.
Yeah.
So I'm a 20+ year also industrial hygienist, occupational and environmental health and safety professional. And basically what we do is we assess the working environment for employees, and we have to determine what it is they may be exposed to, whether it is noise, chemicals, fumes, mist, dust. falls, slips, trips, falls, or, airborne illnesses. That's what we do in our profession. And then we figure out how to utilizing the hierarchy of controls. That's a government required protocol, how to eliminate, substitute, engineer out, or if we can't do any of those things, we drop down to PPE. And we put people in PPE when we can't reduce or eliminate the exposure to the hazard. So this is what we do. We have been very busy from early on going, whoa, because we recognize that the government was violating their own protocols by skipping all of those engineering control and administrative control measures and going right down to the last level of control. We knew that because we are government trained professionals, highly credentialed with degrees and through the EPA, DOT, and OSHA. So we've been taking this guy, we've been giving him all the solutions, the engineering solutions, ventilation, dilution and destructive technologies, and schooling him. And he has done nothing but argue with us and continue to push masks. Probably behind Fauci, he's been number one person in this country pushing masks and N95 respirators and then criticizing us for the things we were saying. Meanwhile, he took all of that information that we were giving him, compiled it all into a book, and is now releasing a book on engineering controls saying this is all we ever needed to do, as if he's now, he's acting like the victim. I can't believe this government, this administration didn't listen. This is all we would have needed to do. And yet he's acting like a victim and, some sort of pandemic savior. And we are just like, he's a charlatan.
Well, he was gaslighting us. And he blocked, when I called him out, he blocked me. He's blocked several of our colleagues, but the irony is that at the beginning of, I have to call it a scamdemic because it was handled that way. At the very beginning, I remember it was on TikTok and Instagram. I had these 3 nurse practitioners just trolling me and ripping my videos and saying, this person deals with an occupational setting and they only deal with PPE and not source control. And I have been screaming along with Tammy and some of our colleagues to get the public to understand our profession is a subdiscipline of public health. Where do most people spend the large majority of their time? In the workplace. So we deal with occupational epidemiology, occupational health surveillance, total worker health. So it's like why we've been attacked by certain people in the medical field and epidemiologists saying, you just deal with OSHA stuff. Okay, well, OSHA is a public health agency. So, how about Google can be your friend. And the irony now is seeing him post that. It literally brings us back to day one and why Tammy and I have spent so much money on our own dime and spending time away from our family to promote the proper risk reductions. And I actually got deplatformed from Facebook. I remember, may she rest in peace, August 19, 2020, because I said masks didn't work and that we needed engineering controls through dilution, destruction, filtration. So this isn't like I told you so. This is how dare you profit off of something that you contributed to.
That's right. That you knew better, right? He knew better. In his bio, it says, as an inner-city trauma physician, a state health commissioner, and in the 20th U.S. Surgeon General, Dr. Jerome Adams has been at the forefront of America's most pressing health challenges. Just the second Black male Surgeon General, Adams led the 6,000-person U.S. Public Health Service through the responses to Category 5 hurricanes, a raging opioid pandemic, another pandemic created by the government, and a once-in-a-century pandemic. As health commissioner, Adams led Indiana through Ebola, Zika, and HIV crisis and worked with Governor Mike Pence, blah, blah, blah. But what they're saying is that he went through Ebola and Zika. Did we do any of this then?
H1N1? No. Did he ever tell people to wear masks and N95 respirators? Did they ever tell people to stay 6 feet apart? No. Obama was out golfing as if nobody cared because it's just another virus. We have millions of them in our world. We always have, we always will. This is the way the world works. And, he knows proper protocols. This is what is so offensive to Kristen and I, professionally insulting, and then to be gaslighting us on top of it. He actually told Kristen in a tweet, when she called him out on this, he actually said, well, you've been saying this all along, and I'm saying this now. So glad we're all on the same team with a thumbs up. We're like, We're not even close to being on the same team. You are not going to get away with this, because for the last 3.5 years, the protocols that you pushed that violated all known science and proven pandemic response protocols that the government itself requires us in our career fields to follow, by doing that, you directly contributed to a massive public health hazard. I mean, not just creating a greater hazard of increasing the spread and increasing the numbers, like he admitted, untold deaths due to improper protocols when we could have just done this. He pushed that. So now we're going to pretend that, businesses didn't close. Families are not struggling and suffering financially. Children did not lose 2.5 years of their education. There was not a greater public health hazard, the mental health crises. You just think by now going, well, great, we're all on the same page now, that there's no accountability for somebody, you in your position who did this. You can just act like nothing to see here, this didn't happen, and move on. No, I'm sorry. I'm sorry.
Well,
you don't get away with that.
You don't get away with that. And I look at it like, as a nurse, right? I'm master's prepared. I understand how to do some research and stuff like that. Do you understand what a big deal it was to put this as a chapter in my book that is there for forever and ever, right? I even have in here, and I don't know if you can see it, but it's the
hierarchy.
The hierarchy of controls.
Right.
And it says, right, that engineering controls, dilution, destruction, containment is the second one if you can eliminate it, right?
Correct.
And PPE, respirators, not masks. I even put a sentence in here. I said, I was sick, and then said, looking back, I'd stayed in my room and kept my windows open and fans going in all the rooms, increasing ventilation and circulation. I wonder if that lowered the viral concentration of the virus, which we now know is airborne, and why I got better so quickly. After all, this is one of the measures of the industrial hygiene hierarchy of controls states to take. I first learned this from Stephen Petty, the foremost exposure scientist in the country. Now, Stephen has also worked alongside of you. So let me just tell you guys a little bit about Tammy and Kristen. They are both whistleblowers, okay? The three of us, actually, on today was the first day 2 years ago that I met Tammy. And I'll post our little picture. But, after I blew the whistle, her and Kristen reached out to me and said, you're gonna need us. And God is so amazing. He led me to this fire, and he brought these two angels to me to help me through this all. And the three of us, either together or the two of them independently, have been going around, guys, speaking to, can you talk to people about what you guys gave up, what you did for the last 3 years?
Well, I was on a radio show and Tammy heard me, and long story short, she's like, wow, I've been saying the same things. We're in the same profession. Find out we're like 20 minutes from each other as far as living. And then we started off our world tour of exposing tyranny. And we drove down to Austin, Texas. We spoke there. That's where we first met a lot of the frontline doctors and the attorneys that have been in this fight. And for the past 3 years, we have traveled mostly in a vehicle until they lifted the mandates on flights. We have gone to, I don't know how many states, testifying in legislative bodies, acting as expert witnesses in court cases, from custody cases to getting doctors their licenses back, to keeping businesses open, helping restaurant owners. We've done expert testimony throughout our careers, but I never thought I would be on a custody case. And that situation was whether or not the disabled child waiting for a kidney transplant was supposed to sleep in an N95 respirator or not.
Wow.
So, I mean, we have really burned our candle at both ends. But the one good thing is our goal was to empower the people administratively to stand up and do not comply and use the government's own data and standards, especially exposing OSHA's revisionism, again, to peacefully and administratively stand up and not comply. But we've also made some amazing friends and met other colleagues, including people like you. So there's good that came out of this, but I tell you what, it really it aged me about 8 to 10 years. I'm serious.
Yeah.
Yes, and we have also testified in legislative committees like special Senate committee hearings, helping different senators or reps in different states who reached out to us and said, hey, we're trying to push through some bills to prevent mandates on our citizens in our states. Would you come and testify? And then we submitted our written briefs to the United States Supreme Court, which actually stopped OSHA from putting in place a permanent standard, a permanent COVID-19 standard. Can you imagine? On all businesses in the United States, and we won that case. So, we've been all over the place, and God has really used us to do some amazing things and stop this craziness. And so that's how we met you, and that's how we've met the frontline doctors, and like Kristen said, the attorneys that we've worked with. And so it's just been a very small group of us who have been very, very loud, who have refused to sit down and shut up. And that's really the power of the people, where we encourage people, use your voice. One person really can make a big difference. And that's what this little whistleblowers club has become, a tight-knit group of people who refuse to sit down and shut up and are going to lean into this. And we expect full accountability for these people, not only these elected politicians, but these unelected bureaucrats like Dr. Jerome Adams, like Anthony Fauci, who have profited off of this, made millions and millions off of these protocols that have killed so many people. I mean, these are the worst crimes against humanity that we have ever seen in history. And now that we've stopped this, it is our goal to press into this and to see full accountability for these people. And that's why we're doing this. That's why we're exposing Jerome Adams. Because listen, if he had come around, Kristen and I and you, Jodi, have seen a lot of people go, I did not realize that. Dr. Drew, a lot of different people, right? Yeah, they said, I didn't realize this, but then they're humble and they listen, and now they're promoting the facts and they're promoting the truth. And that's great. Had he done that, we would have been like, okay, we would have been working with him, but he didn't. He took the example.
And I have to give credit to Dr. Kevin Bass on X, Twitter, whatever you want to call it, because he had a quack list. I was on it. I mean, I've interviewed him on my own podcast. We are welcoming to people who can find the information. But like Tammy said, he blocked me instead of messaging me saying, I understand, but please hear me out. No, I will not be gaslit. And I'm not afraid of putting people on Front Street and publicly shaming them when they have caused businesses to shutter and lives have been lost because they like to ignore a proper pandemic response with a multidisciplinary approach.
That's exactly right. And I think, we'll close this part up here, because here's what we did, the three of us and so many others. We were comfortable being uncomfortable for the sake of morality, integrity, and truth. The three of us, like I said, we have spent thousands of hours donating our time. None of us get paid to do what we do. None of us. But we've heard throughout the last 3 years, so many people knowing the truth, but refusing to speak it because they're more concerned about their paycheck. And what has happened because of that is these crimes. We have so many deaths, physical deaths, that people have passed away from this earth, but you don't understand how many countless more are dying daily, spiritually and mentally and emotionally because of this. And so when we talk about ventilation, I just want to make it clear that this is basic 101, right? This isn't something that he should have said 3.5 years later. Oh, we messed up. We should have started from step 1, step 2. And like the lady said, a multidisciplinary approach instead of an oligarchy telling us what we're supposed to think, feel, and do. Thank you, ladies.
That's right.
Thank you.
They're always so great to talk to. I just am so blessed to have this tight-knit whistleblower family. And in saying all of the things that we talked about, the government mishaps and what they should have done, what they could have done, and what they didn't do, that now they're coming out and speaking against. Another one is nasal pharyngeal sanitation. And my sponsor, Immune Mist, this is a spray, a dilute povidone iodine spray that you squirt up your nose to eliminate 99.9% of virus, bacteria, and pathogens. They also have a mouth mist, an oral cleanse that you just spray into the back of your throat. And guys, I support this as a prophylactic treatment. We had this, I've known about it since 2020, okay? And it's literally dilute povidone iodine that we could spray up our nose and in our mouth. So if we inhaled, right, or breathed in these viruses and bacteria, we could stop the replication process in its tracks. So I highly encourage you to go to immunemist.com/RN Jodi. If you use code RN Jodi, you get 10% off. And so I want to just briefly talk a little bit about the thought process of what medical professionals do. And whenever we're faced with anything. So for me, I'm an ER and ICU nurse. That is what I did before I blew the whistle. I was also hospital supervisor. I've worked in practically every area of nursing that you can think of, from pre-op, PACU, pain management, detox and recovery, chemotherapy, med surge. I have done so much. And all of that, we have got to use critical thinking. And that is something that they did not do. Our government did not do it. And instead, they had a narrative that they pushed via mainstream media, and it was propagandized. Everything that you heard, these little taglines, do it for others, not for you. You know, you're going to kill grandma, put a mask on, care about your neighbor, all of those things, that was propaganda. And in my book, Rare Courage, it's behind me too. I talk about these mishaps, right? Or actual just blatant refusal of the truth. And in chapter 1, I title it Something Isn't Right, right? Something isn't right. Something was happening and it just did not feel authentic. It did not feel real, right? All they did with their 24/7 death toll ticker was push propaganda. My next chapter is called The Misuse of Masks. Okay. So how did this nurse know that immediately in 2020, when the rest of the world and the rest of my colleagues, the nurses and the doctors, were all just, you know what they were doing? They were using emotion. They were saying it's better than nothing. And it's like, that's not how we do medicine. That's not how we do medicine, guys. Where is your evidence-based practice? Where is the evidence? Like Tammy and Kristen, what they were talking about, these OSHA standards, they have known this for decades, since the 1960s, I believe. Same with masks. We have known that masks do not stop viruses for decades. We didn't need to implement this on the world and then 2 years later do another Cochrane review of masks and say that they weren't effective, right? Matter of fact, I stand by this. They caused more harm than good, way more harm than good. Not only did it cause harm with mouth issues and skin issues and breathing issues, anxiety, but it's the fear that they represented. They represented fear. When you saw someone in a mask, they were fearful, right? They were compliant. And that was another thing, is compliance. And so I really want to encourage you guys truly to speak up, grow a pair. And I don't say that lightly. You know, my messaging, it's been 2 years. I celebrated my 2-year whistleblower anniversary this week. And trust me, it's not really much of a celebration, except that I submitted to God. and said, your will be done, not mine. And this is what he led me to do. So that's a big reason why I celebrate what I've done, is because I was faithful. I submitted to him and I carried out the plan that he had for me, right? He tells us, for I know the plans I have for you. And so I trusted in his plan. And now here I stand 2 years later, speaking to all of you. It's wild. I never thought I'd have a radio show. I never thought I'd be a podcaster or an influencer or somebody called a hero. I never knew all of that. But I'll tell you, with the people that the Lord has put in my life, James O'Keefe, Mike Yoder, my attorney, Ryan Heath, another attorney that has helped me out with my Arizona cases. I mean, I feel absolutely blessed, and I feel blessed to know all of you. I feel blessed that I in some way inspire or encourage you. And that's why I also want to talk to you about the community, the private community that I am creating. I have given a lot of thought. I have put in a lot of education and money into learning how to do this in the best way, because throughout my time, my last 2 years of not working in the hospital, I have been trained in functional medicine for nurses, life coach, health coach, and I think, yes, I could have a very successful private practice with just a few people, but my goal is to reach as many of you as possible. I want to help women of faith who are anxious, lonely, fearful, not knowing which way to move, right? Have low energy because of the bad habits that we've created, or the loss of family, or the loss of friendships. And I want to empower all of us. I want to create a community of empowered, bold women for God, and people shining their light, or women shining their light out in the darkness. I know so many of you have lost family and friends and your careers over this. But like I said, the Lord has blessed me with some amazing people in my life. And I figured the best way that I can do that and inspire more people to come to God and to walk in peace and live in joy in their life is to have this private community. And so I will be launching that this week. So make sure you go to jodiomalleyrn.com and subscribe to the link in the bio, because you will get a link on how to join this private community. I will be coming in live with you. I want you guys to interact with each other and lift each other up, and hopefully there's so many women that join this. I want you to tell your friends and your family, and I want you guys to create community. I'm calling it the Truth Movement, but I'm open right now. Whoever comes in over the next couple weeks are going to be my founding members, and I am going to work very closely with you guys and hear what you want, hear what you need, and bring that to you. And then I'm going to shut that down, and we're going to work closely together and create something super special before we relaunch it to the public after the new year. And so JodiO'MalleyRN.com. And when you join, you will get a signed copy of my book as my gift to you. And let's change the world, guys. God bless.